and I'm the director of the EL-DNP program. And my co-presenter today is Dr. Marjorie Barter, Professor Emerita. And Marjorie is actually the professor who set the program up several years ago. And we are happy to have her currently teaching in the program on a part-time basis. So thanks, Marjorie, for joining me today.
I'm very happy to have joined the webinar, and I welcome you all. And we look forward to talking about the program, and feel free to type your questions in as we move along, and we'll probably have a long time to answer questions at the end of this webinar.
Right, very good. So everyone should have a chat function at the bottom of their control panel, and you can chat, type some questions in, and then at the end we'll look at those. It looks like we've got about 11 people on, and we're going to go ahead and get started now. So we're going to talk to you a little bit about University of San Francisco, the history and the purpose of the DNP as a degree, the Executive Leader DNP overview and how that differs from the traditional DNP program. We're going to go over our program details, our curriculum, our schedule. We'll talk about admission requirements, and then we'll do a Q&A. We are recording this webinar, and it will be available for you to share or to view once again in 72 hours. So University of San Francisco is in the heart of San Francisco. We're the first institution in California to offer the DNP advanced degree. We graduated our first class in 2008. We are the oldest university in San Francisco and the second oldest institution for higher learning in California. We have over 150 years of granting degrees, and all of our programs are accredited by the Commission on Collegiate Nursing, or also known as CCNE, and approved by the California Board of Registered Nursing. We have been rated one of the top 40 best nursing programs in the nation. We have a motto at USF, which is change the world from here. And we really focus on preparing health professionals who provide a moral compass to transform healthcare in order to promote equity and positively influence quality, delivery, and access to care. The USF Advantage looks at having a higher standard and a passion for justice as a private Jesuit university. And our DNP students really are equipped to change the world. Their projects have been very, very successful, and we've had students from all over the country and 2 international students thus far. The mission of the School of Nursing and Health Professions is to advance nursing education within the context of Jesuit tradition, and that is diversity, social justice, leadership, and critical thinking. And the School of Nursing and Health Professions not only includes nursing, where we have a large undergraduate population, a graduate population, but we also have a psychology degree, a PsyD. We have a Master's of Public Health. We have a Bachelor's of Health Science. We have an FNP program as well that is awarded at the doctoral level. We have a Master's of Healthcare Simulation program and a Master's of Informatics. So just to keep that in mind, we're a full service institution. We just don't have a medical school, but we sometimes borrow medical students from UCSF if we're doing interprofessional simulations. So I'm going to talk about what the DNP is, and then I'll turn it over to Marjorie to get into more detail around that. The DNP is the highest practice degree any nurse can achieve, and it is a terminal degree, and it is very different than the PhD. An advanced educational credential for those who require advanced practice knowledge but do not need or want a strong research focus. And this is for folks who've always wanted to get their doctorate degree but don't want necessarily to do research. This is a very practice-focused nursing doctorate. And practice isn't always clinical practice. It could be clinical practice, but it could be leadership, administration, and really looking at the clinical practice that you may lead or oversee in terms of population health, etc. So it's really taking the research that the PhDs have done and applying it to practice. And DNP programs prepare nurses with the highest level of scientific knowledge and practice expertise to assure the best quality of care and provide positive patient outcomes. So Marjorie is going to talk a little bit about our final project, but it's really about making a difference, showing outcome data relative to our patient populations or compliance. We do performance improvement projects and quality improvement, all ultimately to achieve positive patient outcomes. Marjorie?
Thank you, KT. The Executive Leadership DNP program, as KT mentioned, graduated our first cohort in 2008. And this is not very long ago, eight years ago. You can see that this is really a new degree. But if you've been on the AACN website, you will see how quickly this degree has taken hold nationwide. Curriculum has been reviewed by CCNE twice, when we started the program, and then they came back for a regular routine visit last year. And we are accredited by CCNE, as well as WASC, which is the Western Association for Colleges. And so we can go on to the next one now. Next slide. This is a slide depicting the DNP Essentials from AACN, and we emphasize the scientific underpinnings for practice. So we have a very rigorous course in evidence-based practice. We also have epidemiology and data analysis, for instance, so that students can develop the skills necessary to bring the science into executive level practice. And then we look at quality improvement and systems thinking, information systems, technology, patient care technology, healthcare policy, interprofessional collaboration. And one of the things that we've done for the past few years is include our law students who are taking health law courses from our law school in interprofessional collaboration. And we always have them work with our nursing students in the legal and risk management course. And then we're moving into population health, as is everyone else nationwide, because of the Affordable Care Act and accountable care organizations. So a lot of our students now are focusing on population health and system design to support population health. So advanced nursing practice for the executive leader looks a little bit different than advanced nursing practice for the clinically focused nurse practitioner or clinical nurse specialist. Next slide. And there really is an increasing demand for the DNP, and we see that with our own students and our own graduates. Already, the students that we have in our graduating class this December, we have 3 students that have already been offered job promotions on the basis of the fact that they're almost finished with their DNP. A lot of our graduates move on to higher level jobs within the first year after they graduate. I think that healthcare systems are really acknowledging the fact that expert executive practice has seen a rapid expansion of knowledge. And because of all our concerns about patient care and quality of care and patient safety, we have a lot of emphasis on that in the DNP. All the nursing schools are having shortages of doctorally prepared nursing faculty, and DNP prepared nurses are moving into faculty roles in colleges and universities. So I think we're now noticing the relationship between the higher levels of nursing education and improved patient outcomes, and that's coming out in the research now. Because of the increased complexity of patient care and developing expert practitioners who can also use nursing faculty, the DNP has really become an alternative to the research-focused PhD degree. The two degrees really complement each other. The research-focused PhD nurses develop evidence, and the DNP prepared nurses are able to implement that evidence in practice to improve systems of care delivery. So the reasons to consider the DNP, as we suggested, health outcomes improve. We've surveyed our executive leader graduates every year that we've had a class graduate, and without exception, every class has indicated that they really thought the knowledge and skills and competencies that they developed throughout the executive leader program really enhanced their career opportunities and their ability to practice in a variety of settings. And employers are now looking at the DNP graduate as bringing added value to their places of employment. So I'll turn it back to KT now for the next slide.
Thank you. We're seeing, DNPs taking positions not only as chief nursing officers, but director of Center for Excellence, for magnet coordinators, for emerging roles that are leading populations outside of the acute care hospital. So the EL-DNP, the Executive Leader DNP, is really an exclusive program. It's designed for current or emerging nurse execs, so those who are currently in nurse executive roles or those who aspire to be in chief nursing roles or in executive practice, with supervisory oversight of a group of essential services or functions. So our typical student is either in a CNO role, a CNE role, a regional role, or they're the director of multiple programs, multiple units, multiple service lines, or they are someone who is moving up very quickly. They've been a charge nurse, they're an assistant manager or manager, and they're a director, and their next job is going to be a CNO. And this will help build their CV and help them gain experience to move into those roles. So leadership experience at the department or division level is highly recommended. We were the first of kind in the nation, and we think that our program really set the standard and raised it, preparing nurse executives to take on multidimensional responsibilities in healthcare. And Marjorie and another colleague of ours and myself just published an article in a national journal that talks about our program and the rigor in our program relative to our project, a culminating project, and the fact that we actually have a 3-year program in 2 years is says something, because we do go year-round. There are programs out there that will promise to provide students with a degree in a year, and some of those programs actually are not lasting much longer because there has been such a rapid growth in the DNP programs around the country. There's up to about 268 at this time, with about 50 that are moving towards creating a program. And we also have heard that a couple of them have closed. But we believe that, as Marjorie said, our students are really our ambassadors, and we've set the standard for other programs, and we have shared our knowledge with other programs that are just starting up. We have a very unique curriculum which prepares the nurse exec for the multiple dimensions of administrative responsibilities within varied healthcare environments. We are not acute care focused. We talk all about the entire continuum. Some of our students are consultants. Some of our students are in the clinic settings as nurse practitioners. Some are running ACOs. Some are in the business office. We talk about healthcare policy and ethics, quality, safety, and spend a lot of time on high-level financial management and risk management. So our cohort, and we are in cohort number 7 at this time, you travel to San Francisco for 11 intensive teaching weekends during 6 semesters. So there are 2 times you come to San Francisco per semester, and we have 3 semesters per year. And the final semester in your 6th semester, you come 1 time. And that 1 time is for your final project presentation and your hooding ceremony and graduation. So that is the semester that you only come 1 time. These sessions provide time for participants to work together intensively with feedback from faculty and peer executives from around the country. And although we are faculty and we all have doctorate degrees and we've been teaching for quite some time, we find that the value that our students bring to each other very rich, and we facilitate that learning. We have chief nursing officers working with directors and directors of business office working with CNOs who learn from one another, and it's just a very intense learning environment for those 2 times a semester. A sample schedule for those intensive: you need to arrive Thursday morning. We will pay for a hotel room for Wednesday night if you're over 200 miles away. So you have the option of coming in on Wednesday night. And then lunch starts at 12. We have class from 1 to 5, and then we have an evening reception at the hotel. Everyone stays in the hotel. And then Friday morning is breakfast. We have class from 8 to 12. We have lunch, and then we have an afternoon class from 1 to 5, followed by yet another evening reception. And then on day 3, which is Saturday, we have morning class at the hotel, and everyone checks out at noon, and they have a free afternoon to either do group work or to travel home. In between, we have online coursework between each meeting, and that we really feel extends the effectiveness without putting your careers on pause. So the majority, I would say 99% of our students work full-time, have families, have lives, go on vacation, and it is doable. You just need to get your focus into the 6th semester mental model and get through it, and you can still work full-time. So here's just an example of our sample curriculum, and we offer 2 courses per semester, and we have the scholarly communication and evidence-based practice for the executive. So these are courses you may have heard of before, but they're really geared toward the executive leader. Project management for the executive leader, we know that many of you have project managers that work for you, but we want to provide you with skills to not only manage your journey through the 6 semesters, but manage your project. So we provide you skills for that. Population-focused system design and improvement is our epidemiology and data analysis course. Quality and safety improvement, learning about all of the indicators that you need to follow. Legal and risk, administrative practice with our law students. Advanced management of financial resources, and we often have guest speakers that are CFOs or folks in large organizations coming to talk about ACOs and the accountable care movement going forward. Strategic leadership, innovation, entrepreneurship is also an exciting class to really move you into thinking about strategy and leading in an environment of innovation. Informatics in the executive leader, we need to know more and more about informatics, and the folks who teach that, our faculty are skilled at informatics. Many of them are informaticists, and we often have our colleagues from our Masters in Informatics program come in and either guest lecture or teach a component of that. And then policy and ethics for healthcare outcomes for the executive. Marjorie, turn it over to you.
I think something about our program that's very definitive is the way that we handle our practicum hours. The accreditation standard is that the DNP graduate will have 1,000 clinical hours from the BSN to the DNP. So if you have a master's degree in nursing, we credit in your practicum hours from your master's degree. If you do not have a nursing master's, you might have an MBA or an MPA or an MHA. There are many different kinds of master's degrees. Then you have to do the full 1,000 hours. Our curriculum has a practicum course every semester. All 6 semesters you will have a practicum course. And in the very beginning, we pair you with a supervising faculty, and that person will be your advisor and your DNP committee chair, and that person will help you to allocate your clinical hours throughout the 6 semesters. We believe that the best learning occurs when our students conduct practicum hours in their paid clinical or paid employment setting, so that you're not going over to someone else's hospital and volunteering your time to try to complete practicum work and project work. You stay in your own setting and do your practicum hours in your paid employment time. And that can be allocated a number of different ways. You could do 1 hour a day or 8 hours a week or 2 4-hour days, or you might do intensives in your work time to accrue a number of hours, but they're allocated throughout the 6 semesters. And I think that not only creates a high-level learning, but also allows you to translate what information you're learning in your didactic courses into your actual practice to improve patient care in real time. Almost all of our students conduct their practicum hours based on what's happening in their setting. We look at it in 3 ways. There's quality improvement and there's process improvement. Process improvement may not actually increase quality, it may not affect quality, but it may create cost savings. So quality improvement generally improves patient care and may increase the budget. Process improvement is generally budget neutral. And the third area that students do practicum hours is mandatory requirements from regulatory agencies or accreditation agencies such as the Joint Commission or CMS. And those mandatory regulatory requirements may neither improve quality or decrease costs, but they have to be done anyway. So your faculty advisor will help you decide how to allocate your clinical hours throughout the 6 semesters. And it is a cohort class. We try to limit it to 25 students per cohort. And our students generally find a lot of support with their colleagues sitting in the classroom. So they come to the intensive and become well acquainted with their colleagues during our hotel stay. And then the online work is frequently done in small groups, or students can contact each other nationwide between the intensives to provide support or ideas for classwork. Next slide, please. So everyone does an evidence-based change of practice project, and that's the final project that actually gets you the degree. And as I said, it could be quality improvement, process improvement, or regulatory requirements. But you work through the 6 semesters to provide the foundation to actually implement and evaluate an evidence-based change of practice project, which is then written up in your 6th semester. And we want you to apply research to practice, get the evidence, evaluate the evidence, tailor the evidence for your own setting, and develop a project that is implemented and then evaluated. And under the sample projects, you will see some ideas of projects that students have done in the past. Currently, we're having students do those sorts of projects, plus additional projects that run the gamut of the continuum of care. They may be inpatient, outpatient, population-focused, etc. So we have a lot of different projects. Right now, I have a student who's developing a dashboard for a behavioral health management company for key performance indicators for people within the company. We've had students do population-focused systems-level projects that involve 6 or 8 hospitals. We've had students do projects where new graduates were brought into a large hospital setting in Southern California, and instead of doing the traditional new graduate orientation, they trained them to be support staff for implementing a new electronic health record. So the first 6 months of the students' hire, they were informatics people helping nursing staff to learn a new computer system. And then at the end of 6 months, they went on to the units and did a traditional new nurse residency. But they were very well prepared, and that was a very interesting project. There's just a number of different ideas for projects that are available. And all of our students house their projects at the end of the program. They house their projects in our university library, so they can be accessed by anyone. Next slide, please. The admission requirements are listed here. A master's degree, and as we said, if it's a nursing degree, then we transfer in your credits from your practicum units from your nursing degree. About 30 to 40% of our executive leaders have a degree other than nursing. As I said, an MBA or an MPA. And that's perfectly acceptable. And they do very well in the program. It's just they do more practicum hours. The 3.0 GPA, 3 letters of recommendation, a current RN license, and if you practice in California, it has to be a California license. If you practice in another state, it has to be the state in which you're doing your practicum requirements. You write a statement of professional goals, which is generally a page or 2 long, a professional resume, providing transcripts from your undergraduate and graduate work, and then of course the application form, which is done online. So the next cohort begins in January of 2017, and the electronic applications must be completed by December 1st. And we have a very fast turnaround time for reviewing of applications. We're pretty dedicated to looking at them in a timely fashion, so that once your application is complete, you should be able to get a determination from us within a very few days about the acceptance of your application. Next slide, please.
Thank you, Marjorie. So this is we're getting to the end here, and you're wondering what is the bottom line. So we do have a cost of $87,000, and that includes tuition and fees, learning materials, all of your hotel accommodations, and most meals, which is breakfast and lunch and a little bit on the reception. You are on your own for dinner. And if we do go to the campus, which we do on occasion, we would provide transportation between the hotel and the university. You are responsible for your own transportation to the hotel and the airport, any flights and any taxis that you take. There are federal loans available for graduate students up to $20,500 per year, and you're pretty much guaranteed of those loans if you're a graduate student. There are Grad Plus loans, or there are private loans. We've had students actually go to the bank and take out a loan for themselves for their own education because they weren't sure if they wanted to use any tuition reimbursement, didn't want to have to deal with the government. So there's various ways of doing this. We also encourage you to check with your employer to see what your tuition reimbursement is, and that if you are interested in teaching, there are loans available where you can teach after you graduate, and then the loan would be forgiven if you're interested in that. We do offer a scholarship of $1,500 per year if you're a member of ACNL or AONE, and you can use one or the other. So with that, I think we're going to open it up to questions, and you've got your chat there, and see if you have any questions. We can address those. You're not able to verbally ask your questions because the system locks you out and everyone's muted, but you can certainly type in a question. I know we had a couple questions come through earlier, so one of the questions was, is this really doable for someone who's working full-time, has middle school children, and travels in between their being in the office? And as I said earlier, we would love to have you connect with some of the students that are either currently in the program or have graduated that have been in that same position to help you understand how you can balance your life and still get a graduate degree. We also would like to say that the hardest thing to do in moving towards your DNP is actually applying. So that application is a big deal. Once you get through that, it's only 6 semesters away, but it's very important to make the decision and apply. So if you do apply during the summer for admission in January, you have a good 6 months to really mentally prepare for being a student. Now I see here a hand is up on the names, and I don't know if the hand means that she has a question. I don't see anything in the chat. Marjorie, do you see anything in your
no, but I do see that one hand is indicated, so it's possible that one person is typing in a question. And you can type in a question, and they'll just show on our screen as soon as you finish it. You should click send to all or send privately.
Yeah, I see 2 hands up now.
I would like to say, too, I think we forgot to mention a wonderful feature of our program, and that is we are in a hotel in downtown San Francisco, very near Union Square, with many, many wonderful restaurants within 3 or 4 minutes of walking distance from the hotel. So one of our treats is going out for dinner.
Well, let's see, what else? I'm waiting for...
Maybe I should ask Cheryl and Ellen if you're typing in questions, because it's not showing on our screen, but your hands are up.
Well, I would say that if you are considering a program, that we would be happy to connect you with some of our current students. And if you're asking a question about how can I possibly do 1,000 hours of practicum, it is totally doable. We do allow you to double dip in your workplace, any conferences that you go to, any books that you might read, any interviews that you might do. We really try to encourage you to think beyond just going to meetings and thinking about other things you could tap into. Northwest One would be a wonderful organization to do some volunteer work, help with a project, and that's how you can get your practicum hours. So I think Marjorie said around 30–40% do not have the clinical degree, and I think that's one thing that's very attractive to a lot of students in our program, because we do work with those who have non-nursing degrees, and that 1,000 hours is definitely doable.
Well, I'm thinking that perhaps we do not have questions because by now I think they would have been typed in.
Right.
Um, and unless you've typed a question in and neglected to hit send to all, then we don't see any questions coming onto our screen.
And you can just email them. I have the screen up with our emails. And please feel free to email any of us. And Tamara is our graduate enrollment manager, which is also known as our recruiter. And she can answer any questions you have about financial aid, scholarships, loans, and the program itself. You would contact myself or Marjorie. We'd be happy to get back to you. So thank you so much for signing in. We have several students that have graduated or are currently in the program up in Oregon and Washington for those of you from that area, and we'd be happy to connect you with those students and alum. So let us know, and I want to thank you all, and hopefully you have a wonderful evening.
Goodbye. Thank you so much.
Bye.
Bye.
Bye. Let's see. Now, how do I...
I can hear you still, KT. I don't think you're disconnected yet. Can you hear me?